NHS hospital.
Hinchingbrooke Hospital in Cambridgeshire is almost £39 million in the red and requires radical surgery. Tonight, Look East can reveal that private franchisees are now being sought to run the hospital and to solve its financial crisis. It's one of 6 local NHS trusts that the Department of Health says aren't meeting minimum government standards. The region's ambulance trust is having to review staff training and up its game on combating MRSA infection and control. And Ipswich Hospital has failed to meet its 18-week target from referral to treatment, but it says it's now rapidly improving. Let's take a closer look at Hinchingbrooke, where the plan for financial survival is unprecedented.
Little Heather Davison was born early. She's been kept in hospital with her mother Melanie until she's strong enough to feed on her own. Although the Davisons are anxious to start their life together at home, they're enjoying their time at Hinchingbrooke.
Everybody has just been brilliant. Although we keep saying maybe we'll go home tomorrow and that hasn't come yet, we've had the best care possible.
Many of Hinchingbrooke's patients speak highly of their care. Despite the positive feedback, the hospital's been categorised by the government as underperforming. The reason? More than 2 years ago, it ran up a debt of £38.9 million.
The people I feel really sorry for are the staff of the trust, because on all of the patient satisfaction, national targets and quality indicators, then we do extremely well, and the finances at the moment are in ongoing balance.
To cope with the debt, the government's hatched a plan. It's putting the management of Hinchingbrooke staff and assets up for tender. Public and private groups are being encouraged to compete.
I think we're absolutely clear this is not about privatisation. Staff and assets will remain in the NHS. We're looking to find the very best provider, and we're going to ask NHS organisations and other organisations to demonstrate that they can provide the best services for patients, the public and the taxpayer. So this is not a slippery slope, absolutely not.
The decision's been made on the back of the government's new performance-based health check. It's a check of hospital and ambulance trusts, and that's scored on a points-based system that covers everything from finance to the quality of care.
Hinchingbrooke Hospital it's a myth that it's in trouble. It's not in trouble as a healthcare deliverer. It's in trouble because of the internal market in health. And we say if you scrap that, if you start delivering a fully funded national health service that's publicly owned, well, those financial problems are much more manageable, and that wouldn't be a problem.
While the bottom line may be the new measure of an NHS hospital's success, the question remains, will patients like Melanie Davison notice a change in the quality of care if their hospital is run by managers outside the public sector? Maria Veronese, BBC Look East at Hinchingbrooke Hospital.
There's more on that story in this Sunday's edition of The Politics Show. It's on BBC One at 1:35.
A solicitor from Northamptonshire who campaigned on behalf of disabled people has today been cleared of professional misconduct. Yvonne Hossack would routinely challenge local councils over their care of the elderly and disabled, but her tactics landed her before a disciplinary tribunal in London. We'll hear from her in a moment after this report from our chief reporter, Kim Riley.
Loyal supporters of Yvonne Hossack stood by her today as she faced a judgment they knew could end her career. She's saved dozens of care homes from closure, but stood accused on 6 counts of breaching solicitors' rules of conduct. It follows complaints from Northamptonshire County Council and 2 other authorities. Are you feeling optimistic?
Not really. I don't know how to feel. I mean, my professional body built these gallows high, didn't they? It depends if the disciplinary tribunal is going to realise that the gallows are built on sand. That's the question, and I don't know the answer to that yet.
In the event, the judgment was over almost before it began. The tribunal chairman went through all 6 of the allegations against Ms Hossack, adding after each one, not proved. There were gasps of delight in the room. The panel did find one breach of the rules, described as a breach of confidence at the lowest level.
I'm absolutely delighted. Justice has been done to this lady. This lady should never have been here at the start. And that is, this is true justice for Yvonne. Where would we be without this great lady? Where would we be? I'm absolutely delighted.
This is a marvellous, magnificent day for all of the people in England. The disabled, the infirm, the very ill people and sheltered housing and all people that need Yvonne Hossack.
Her supporters say Miss Hossack is the only solicitor in the country working to prevent the closure of care homes. They're delighted tonight that for her, it's business as usual. Kim Riley, BBC Look East, Central London.
Well, I spoke to Yvonne Hossack shortly after the ruling. She told me it was a miracle and she was delighted for herself and her clients. I asked her if she'd been confident about which way the tribunal would go.
I was always confident that I'd done nothing wrong, but what concerned me was that these allegations were indulged and colluded with and brought forward, bearing in mind that they were brought by my client's opponents and without even the knowledge, let alone the consent, of the people themselves. So that did worry me as to how it might go further.
You had a lot of supporters backing you, including some heavyweight supporters in the likes of the Home Secretary. How much do you think that helped your case?
I think it did help my case. I think what helped even more was the man who came in a wheelchair, Andrew Norman, and the man who came on his sticks, Eugene Hyde, because for the panel to see the real human beings that I help will have brought home to them their vulnerability and the need that they have for the support of someone who truly does care about the outcome for them.
You do obviously, though, rub people up the wrong way, rightly or wrongly. Do you feel that your style will have to change at all as a result of this?
Certainly not. Obviously it rubs people up the wrong way if they're the ones that are closing care homes, disability centres, or taking away care from my clients. But it's notable that the only people who feel that I'm going about things the wrong way are local authorities, a jointly instructed psychiatrist, and the owners of a care home that they plan to close. Those are the only ones that thought I'd done things the wrong way, and I don't think it's any coincidence that they were my client's opponents. Obviously, they want to get me off the case. If they haven't succeeded, let's hope they've learnt something.
Yvonne Hossack, thank you very much.
Thank you.